Hello, and welcome to all of our Gold participants from around the world. Welcome back to our Gold family here. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here for Gold Learning. Well, it's my absolute pleasure to be sitting down today with Lisa Amir. Welcome, Lisa. It's great to have you here.
Thank you, Fiona.
And I have to say that this topic it jives with me, Lisa. Just so you know, it's one of those things that I've been obsessed about since the beginning of time. It feels like because not because I knew how important it was, but just I think I just loved always wanting to hear more. So it sort of evolved into this taking a lactation history is very important, and those types of things. So I'm excited that you're here. I'm so glad that you agreed to come and talk with us. Would you like to share just a little bit of what you are going to be talking about from your presentation here at Gold Lactation?
Yeah, thanks, Fiona. I think taking a history is something that has been neglected in talking about breastfeeding and breastfeeding, helping women with breastfeeding problems. People often want to get into solutions and quickly jump into helping people. And I think it hasn't been recognised that it's very important to meet the mother and the family where they are and understand what their concerns are, and how important it is just to ask the right questions, when to ask a question, when not to ask a question. Sometimes it's about being quiet. And so it's something that I realised that when I work with the lactation consultants at the Women's Hospital in Melbourne, that it's something that they haven't been taught. So I've been kind of working on this talk, I guess, for many years, just telling them little snippets and then adding a little bit more. And so I'm very happy to be sharing it with a wider audience today.
Oh, that's wonderful. Yeah. And as I mentioned, it's really something that I've, fallen in love with over the years, and knowing that if you just take a step back, become vital, in the process of what we're doing. So I can't wait to hear the full presentation. And of course, Lisa is going to be here as part of an add-on package at Gold Lactation. She's going to be part of our Focus on Foundations add-on package. You can join us at goldlactation.com. That way you can find out exactly what's coming up. Our conference is right around the corner. April 1st is going to be our keynote day with Kathleen Kendall-Taggett, and she, of course, is going to be here with us. You'll be able to access that free education as well. So go to our website, log in, check it all out, and you'll be able to meet up with all of these great speakers. Now, Lisa, I promised I would dive into what's happening in your life, and I can't wait to hear. It seems like ages since I've caught up with what's happening with you. So perhaps you want to share with us what life is like with you in Melbourne, and what it looks like on a day-to-day basis, and what's coming up with you.
Yes, well, every day is different, really, for me, but I spend one day, usually Tuesday, working in a general practice where I see mothers and babies with breastfeeding problems. So we call that breastfeeding medicine. And I spend half a day, Friday afternoon, at the Women's Hospital in a clinic there where we see the more complicated breastfeeding problems. And then most of the rest of the week I spend doing research. So that's based at the Judith Lumley Centre at La Trobe University. And so that can mean giving a lecture like this, or giving a lecture to the midwifery students, um, putting in an ethic. Next week I need to put in an ethics application for a project we're doing. I'm in the middle of analysing data from a project that I did late last year about breastfeeding in public, where we spoke to women and we spoke to the general public, and so we have survey data and focus group data, and so I'm busy trying to analyse that because we have a team meeting coming up in a couple of weeks with
Mhm.
colleagues about that.
Wow. So busy, busy. I mean, it doesn't seem to stop for you, Lisa.
No, and if I have any time in between the rest of my life, I'm busy as the editor-in-chief of the International Breastfeeding Journal. So this is an online journal that I started in 2006.
Yeah.
So That's got busier and busier, so that fills in any little gaps that I might have in between seeing my 2-year-old granddaughter and, as I was saying, visiting my elderly mother who's 93. So my life is pretty busy.
Yeah, wow, that's amazing. Well, it's exciting to hear what you're doing and how busy you are. And I know that you've been doing this for quite some time. We won't say how long it is, okay, Lisa, but I know you've been around for a while. What what drives you? What has held you here? What inspires you? Do you have mentors you work with? Like, I just want to know because sometimes we get really stuck where we are in our professions. And so, what has given you the gift of continuing to move forward?
I just think that as soon as I kind of met breastfeeding when my first daughter was born in 1984, I was just kind of blown away. And I thought, how come I didn't learn about this as a medical student or as a doctor? Or I'd worked at the Children's Hospital here and really had no idea about breastfeeding. So I wanted to learn more and joined the local breastfeeding association and started reading books. And then so I sat the exam in '89, and I guess I was just interested in the topic. So I started going to conferences and then, met the people who wrote the books and was lucky enough to be able to do a PhD, I guess, and then get a research position. So I've just been able to really follow, yeah, what I'm interested in.
That's so exciting. Well, and inspiring for those of us who are listening in because it, like I mentioned, it can be challenging, and sometimes changing what you're doing in your practice too. So you've gone on to, of course, you're teaching. Is it full time now, Lisa? You're teaching,
Well, not well. I have a research position, so
right? Okay. Yeah.
mostly it's doing research. So that means sometimes, there's occasional
Yeah.
lectures, but mostly it means I'm supervising higher degree students. So I have a number of PhD students, um, and so helping them with their research,
That's amazing.
and yeah, as well as doing my own projects.
That's awesome. With those students coming up, Lisa, what are they studying with you primarily?
Um, One student who finished last year, Moni Rani Sahar, was doing a project looking at medications and breastfeeding. Student I have from Saudi Arabia, Nawal Abdul Ghani, is looking at skin to skin care after birth in Saudi Arabia.
Hmm.
Um, Anita Moorhead is looking at diabetes and antenatal milk expressing.
Right.
Um, and Ran Mali is in Sri Lanka. She's looking about at transporting milk for preterm infants from
Wow.
home to the hospital. Um, yeah, so all different things.
Yeah, and that's very inspiring. What I was going to ask you is about your students, and if in this generation of students that you're working with, are you seeing shifts and changes of, their cultural background, their understanding, their drive, their need, their want to know more? Has there been a shift, Lisa, or are students always students? They just always hungry for the latest research and evidence when it comes to these things in the lactation field?
Yeah, I think it's hard to say. I think, there haven't been all that many people doing PhDs on the topic of breastfeeding. And so,
Right.
like when you ask me, did I have a mentor? Well, not really. I used to meet with other general practitioners who were doing PhDs, but I didn't know anyone else who was doing a PhD on the topic of breastfeeding. So I think now there are more people. Um, and yeah, everyone has their own interest, what it is that they want to study. Um,
Well, that's just fascinating. And thank you for sharing that because I think for those of us who are not in your position, don't know what's happening with people coming up and doing their PhDs and the passions and the research because we're in a different area. So it's great to hear what's happening on your end of things too. So thank you and thanks for teaching those students. It's great to hear that you're doing such great work for the next generation.
Thanks, Fiona.
Well, thank you to Lisa Amir for joining me here today. And once again, I'll just remind you that Lisa's going to be here as part of our Gold Lactation Conference at goldlactation.com. You can find out all the information there about when she's presenting and, of course, all of our other speakers that are going to be here starting on April 1st. 2019. We'll look forward to seeing you here, Lisa. And thank you to our listening audience for joining us here today. Bye bye for now, everyone.